We're rolling.
At this time, I'd like to call the Town of Ledyard, Connecticut Town Council Community Relations Committee regular meeting for Wednesday, May 19th at 6:30 p.m. I'll do a roll call. Bill Psalms, Councilor Psalms.
Present. Present.
Councilor Ingalls.
Here.
For the record, Council Administrative Assistant is sorry, someone's knocking on my door. Nobody's home. It's Roxanne Marr. Also here is Scott Johnson from our Senior Citizens Director, and Karen. I'm gonna Goetchuis from the Ledyard Visiting Nurse Association.
And Mr. Hartling just joined.
And Mr. Hartling, Superintendent of Schools. Is there any citizen comments? Is there any citizen comments? Seeing none, we'll go into informational items. No information. Review and approval of prior minutes. Do I have a motion to approve the regular meeting minutes of May 5th, 2021?
I move that we approve the regular meeting minutes of May 5th, 2021.
Thank you.
Councilor Psalms, second.
Thank you, Councilor Ingalls, Councilor Psalms. All in favor?
Councilor Ingalls votes aye.
Aye.
Councilor Psalms votes aye.
Councilor Washington votes aye. 3 ayes. No nays. No abstentions. At this time, I'd like to take the opportunity to for regarding our upcoming presentation for the community workshops and the schedule. We have with us Senior Citizens Director Scott Johnson and the municipal agent Karen. I'll just say Karen because I won't get it right. So this time, Scott or Karen, could you proceed to give us a lowdown? The plan is to have a informational meeting, public informational next month, and this is an opportunity to give us an idea of what the presentation will be. Take it away, Scott.
Right. Now, do you want me to give the presentation or just?
It can be an overview of what you plan to do. You have to do the whole presentation. We won't make you do that twice.
All right. So I guess to keep
Can I just add, Scott, what we want to know, we want to sort of help you tease out what the residents want to hear.
All right. So, I mean, I threw a quick PowerPoint together and I can certainly edit it for, the next meeting. I started with just going through some of the programs we offer, like our hiking group, yoga classes, aquasize, book groups, card games, fitness classes, bingo, quilting, special events, things like that. I was going to talk about our trips. We do different day trips, shows, plays. They go to museums, lunches, flower show, different, lighthouse tours, things like that. They're currently on hold with COVID, but hopefully starting back up pretty soon. Go through our transportation services. We have our senior center services, which are on the left by our senior center vans. So go through, our medical ride, shopping. We do bank runs. Bring seniors back and forth to the center, to voting, elections. Then I was going to go over, we have some programs for transportation outside of our transportation hours. So we have grant programs such as the ECTC Dial-A-Ride program, where most years there's a fee. This year, actually, it's free, where the individual gets a set amount of round trip rides per year, or single one-way rides. And then there's also a caregiver mileage reimbursement program. So if you can find, a senior finds a neighbor or a family member, they can actually get reimbursed for the mileage to bring that senior to their medical appointment. And they'll be reimbursed by the grant. And then there's also the travel voucher program, which is used for after you use all of your Dial-A-Ride rides, you can purchase a booklet of vouchers, which can be used through the local taxi services or livery services it's like a discounted, I think it's almost half off the rides, giving them a more affordable option for transportation if it's outside of the senior center's operating hours. And go through our, our lunch and breakfast. We have, our cafe meals. We're currently doing takeout meals, community meals where we have different groups come in and actually cook Wednesday meal for the seniors there that day. And then also we do holiday luncheons. And then I was going to go over some of our other services, like our Meals on Wheels program, how we have the hair salon, podiatrist. We typically offer, when we're not in COVID, the AARP Safe Driver program, which allows them to get discounted rates on their insurance as well. Karen comes in and does blood pressure clinics. We also have done flu shots with the Ledyard Health District. We've done prescription take back days, and then Karen also does the renter rebate program.
What's that, Scott?
The
The renter rebate.
Karen can probably speak a little more on that. That's actually her
Okay,
area of expertise.
all right.
Excuse me for 1 second, please. And I'm going to ask the counselors to indulge me. Because as I'm sitting here, Scott, you're doing great, and I'm coming up with a bunch of questions. And this is a question out to the counselors. Would you find it beneficial to actually let Scott and Karen go through the presentation in its entirety? Because I'm just thinking about, like, certain questions are coming up, and I'm not sure. I'm not sure if they're going to provide them in a full overview or giving them like questions of prices and things of that nature. Are those going to be addressed in the larger scale? I know I'm a little all over this, so be patient with me.
I was okay with this pace, like,
Okay.
gets us through it quickly, but I do have questions. I think, we should just ask them.
Yeah.
Okay.
I would recommend we wait till the end because some
Yep.
questions do end up getting answered. And but in interest of not drowning people and trying to get people to take a sip out of a fire hose, when we do the public presentation, I think we should let Scott do it like as he's doing it now, and just let them ask the questions that are of interest to them. Otherwise, what they really want to know is going to get drowned in too much information.
I agree.
So you just stop at the end of each page, ask for questions, and if not, move on. That would do it.
Yeah, and I would go into like a little more detail on things like, explain TVCCA, and if you want to register, you'd call TVCCA directly, and then you get put on the list, and the meals would come through the senior center. I just didn't want to give you guys the full, all the talking points. But if there's anything else you think we need to add, or things that you think they're going to ask, I can try and make sure to include it in the presentation.
This is Councilor Washington. I think being seniors and such, I'm thinking that they're going to ask about cost. So you mentioned about the cost for the rides and things of that nature, and the prices, and maybe the window periods for where the lunches and stuff like that take place. So just giving an idea what those costs are, when you talked about the voucher program.
It's a good idea.
All right. Yeah, I can make sure to have all that, because they change every year too for like that program specifically. So actually I want to make sure I have that fresh, because last year was one number, but this year is a new number. And actually I might even be able to get the upcoming fiscal year amount before the next meeting, because it's going to change July 1st. So the cost of that, we're updating the grant right now. So
If you could also, on some of your programs where you have the highest participation, just give a sense of how many people benefit from that. I think that's really helpful for everybody to know. I know when first time we went to Parks and Recs, Ledyard girls softball opening day, it just blew me away how many people showed up. And I think people like to see that kind of information.
All right, yeah, so I can pull out some of the more popular programs with numbers.
This is Councilor Washington. Just as a question, does the senior center do anything, given that everybody's gone to there's a lot of virtual stuff going on, does the senior center do anything with the virtual, in a virtual world?
So we did start a Wednesday virtual happy hour that we've been doing, because typically we have a Wednesday lunch that all the seniors would attend, and with COVID, they weren't able to come attend that lunch. So we started doing a takeout lunch. And as a way to supplement the social aspect of it, we were putting up a Zoom room where they could, it was a half hour after they would pick up their lunch. So they would go home and basically eat their lunch on Zoom with some of the other seniors and socialize. We did try to offer some Zoom classes, but they were not very well received. The seniors are very adamant about not wanting to try Zoom. We've got a few of them on it and they've said how easy it is, but even that, they still said they're not going to take a yoga class on Zoom, even though they now know it. They just don't want to.
Understandable.
But we are excited to start the in-person again, because we tried a few times with the virtual and it was unsuccessful.
Okay. With me, what's the other? So Scott, so when you go through the regular, as Councilor Ingalls was noting, so you go through the regular discussion. Sometimes, if something comes to mind, feel free to bring it up as if that you may think they may have an interest in, only because sometimes people don't know they have that question until somebody mentions a question or provides the information. Does Councilor Ingalls or Councilor Soms have any further questions?
Yeah, I have a question. So Scott, this is the same question I asked the other department heads, and it's, is there something that you do with the seniors that you wish people knew more about so that they could take advantage of it?
I mean, there's a few things, like with the pandemic, TVCCA, the Meals on Wheels program has been a huge thing that not a lot of the seniors know about. So it's for homebound seniors, but we have a few seniors that would come to the senior center every day with the senior center van. So essentially they're considered homebound, but they would come and eat at the senior center. They rely on the center for their shopping and their groceries once a week. And a lot of them, when the pandemic started, didn't know that we had that Meals on Wheels program where the meals would actually get delivered to them. And we actually pushed to have some of those individuals signed up and actually kind of made the call for them, because it's more than just a meal delivery service. It's also like a wellness check,
Right.
And socialization for those homebound seniors as well, which was really important in the pandemic, because I know we have 2 or 3 individuals that their whole life was coming to the senior center 5 days a week. In the pandemic, they're essentially just put into isolation. So at least that gave them somebody once a day to come knock on the door, have a little conversation with them, deliver them a hot meal, make sure they're eating, and kind of check in on them, which was nice as well.
Yeah, that's terrific. And I think that's really a powerful thing for people to hear about, not just the seniors themselves, but of course, friends, neighbors, family members who also don't know about that and would definitely tap into it. So I would definitely highlight that during your presentation.
Yeah. And then the other thing would probably be the mileage reimbursement program that we have, because a lot of individuals will provide rides to a senior and they don't know that they can actually get reimbursed for that mileage. They just have to come in and fill out the form ahead of time to get signed up for the program. So if a senior has a friend or a neighbor or a family member that's bringing them to their doctor's appointments, they can actually get reimbursed for helping them out with that.
Wow.
Never knew that.
Some of the burden off
Who
of
runs that program? Is that a state program, TVCCA? Who does that?
So it's through our Dial-A-Ride. It's actually a grant that we write with the area towns. So I believe it's us, Groton, New London, Waterford, East Lyme. I don't know if Liz or Preston's part of it, but there's a number of the towns in the area in Eastern Connecticut. We collaborate on this grant to provide transportation services outside of the senior center's scope. So if there's 2:30 of the senior center closes and someone has a 3:30 doctor's appointment, they can then they would have to come through us first, fill out the form. This year it's actually free, they can get up to, I believe it's like 26 one-way rides for free to medical rides outside of our transportation hours. And
Wow.
then there's also that reimbursement program and then the voucher program that go with that grant as well.
Wow. That's
Is that on the
terrific.
web? Is that on the website? Information about it?
It should be. I gotta talk to Regina about updating it on the town website. It's south. We're working on getting everything updated because with the van grant, we
Yep.
need, different, Title VI plans and things like that posted on various websites. So I've been looking at some of the town website information. It is a little outdated, so I'm trying to get that updated. I believe it's up there in some form, but it might be the wrong year. So it might say that you
okay.
have to pay $20 when this year it's free because we had money left over with the pandemic that wasn't spent in the previous year. So we just carried it over.
Okay, well, now Karen,
Yes.
so Scott, you're gonna go first and then Karen's gonna go? Perfect. Scott, just before I mess this up, so bear with me because I'm, so Scott, I think we're done. Or is there any other questions for Scott in case he doesn't want to hang around?
Good.
No.
Okay, you're more than welcome, Scott, to hang with us.
I do have a 7 o'clock meeting, so I probably will jump off here in a few minutes, but.
Yep.
hang around for a
Okay.
little bit.
Well, thank you very much for coming and we look forward to seeing you.
No, thanks for having me.
Okay, Karen.
Okay. This is a very last minute thrown together. I wasn't sure what you were looking for. So I put together some of the kind of dry data, but I can tweak it. And as you said, depending on what residents are looking for. So I gave an overview of who we are and what we do for the town and the residents. So our biggest is home care. So everything's under the VNA, which is a Medicare certified agency. And those are the services we offer. And I didn't bother listing the insurances we take because we take most of them. And the visits, I gave you the number from last year of how
Wow.
many visits we've done.
It's a lot.
So, so depending on how many patients we have is how many visits we get. The more patients we have, the more visits, obviously. So we have everything that every other VNA has under a license. We even have a back room in social services that has equipment. So for residents, they call us up and say, do you have a walker? Do you have a commode? Do you have, so we just carry a whole slew of items that we, either they can have them forever if they need them, or if they want to give them back and we recycle them if they're, the equipment is functional and it's cleaned. But so we, whatever they need, we try, so they don't have to spend money and they can just, our therapists, occupational and physical therapists always go back there and bring things to patients' homes if they had knees or hips done and they need something temporarily. So we kind of try to fill we try to make it as easy as possible for people, and so they don't have to spend any money if their insurance doesn't cover it.
Oh, wow. So what's the process of getting hold of the Ledyard VNA?
Well, I think that's on one of my next slides.
Okay,
So
I'll wait till the very end, Karen, sorry.
okay, there's only about 5. So, referrals, here it is. So since we're a Medicare certified agency, we get them from a few places. Usually it's the doctor maybe calling up saying we have someone in the community that needs help. Hospitals, of course, call us. We get most of our referrals from L&M and Yale. In fact, we are a provider for them. We've signed an agreement with them saying that if we adhere to certain standards and quality measures, they will give us patients. So, and I'll talk a little bit about that. Hartford Healthcare is kind of they do their own thing and they're very secretive, and they give us some of our patients when they ask for us, but really they're kind of inclusive and they don't want to share. So we get it from family, we get it from friends, we get it from community referrals, the senior center. Scott might call me and say, somebody's having an issue. So we'll look into that and call them up, or we go visit. We do a lot of community services, just do a visit. They may not need us for more than one. And then of course the patients themselves. We have a lot of residents calling up saying, oh, I'm having my hip done next week. Can you come see me? So we get it that way. And then of course they can phone us, they email us. Epic is the hospital's computer software that we can go in and look at everything the doctors look at once we get permission. And then of course, Village Market, somebody always runs up to you at the vegetables and asks you to, could you go see somebody? So, I mean, that's this community, VNA. So we get referrals a lot like that. So, so the home care part here, could we go back to the, Roxanne, just go back to the, yes, the revenue. So the revenue, which is in my annual report every year, shows how much money we take in from insurances. As you can see, Medicare is the brunt, hence why there's so much competition for home care and hospice, because they pay a lot of money. Medicaid, we don't have as many patients, but they do. And then private insurances, which is like United Healthcare, Medicare, Connecticut, those kind of managed, which people have a choice of signing up for whatever they would like. Private pay, we have people in the community that need a shower. So we have home health aides that after they don't qualify for care from a nurse, a skilled nurse, they continue with an aide to get care in the home, maybe once a week. And we charge them $25 for the aide to go in for an hour, which is super good when you compare to companions and homemakers and they can have us as little as much as they want. So it's very flexible. Miscellaneous is, as it says, and then flu shots. We didn't do a lot of flu shots this past year because people get them everywhere else. They give them out, I think, at Dunkin' Donuts now. People drive in and get their shot and coffee. And so we used to be the only game in town about 20 years ago, but now doctor's offices, CVS, so they're just, which is fine. As long as people get their flu vaccines, I don't care where they get them. But we will deliver to the homebound people, which is very important. So when they're on, so that's the total revenue we brought in last year. So we average, when we have more patients, we can go over $1 million. So again, it depends on how many residents call us up. Okay, and then let's see, the next one is, I've talked about that one. Okay, so this is kind of another one back, Roxanne. So this is kind of, again, an overview. We do have the school nursing, which is super important. The 5 schools, we have an RN in each school, and we have an assistant in each school. And if you've had children in the school system, you know how important they are and what they do today and the range. And this has been a challenging year with COVID, like for everybody, but they've been in school the whole time. They've done a great job, as the schools have done. So it really was better than I thought it would be in August. As Scott mentioned, we do the blood pressure clinics every month. And then we have people walk into our office all the time. The LV's clinic is alleged volunteer emergency services. So God forbid your house burns down, these are the people who are coming to your house, the firemen. So Dr. Gates at the high school every other month runs a clinic and gives them free physicals. We do EKGs, spirometry, we give them PPDs, and he clears them for duty. And depending on their age, they do it at a certain amount. And and like I said, it's free for the town. And we've been doing that for years. We used to do the ambulance service. Sorry, that's the clock. We used to do the ambulance service, but as you know, American Ambulance took over, and so we no longer do that. The flu vaccines I mentioned, and then the COVID vaccine, we did get Johnson & Johnson last week. So we're doing our homebound patients. It was a fight for months to get it, but Ledyard finally let me have vaccine. So we are, we'll go to your house. They can walk into the office. We'll do whatever it takes to vaccinate. Potassium iodine I have available. I think did I spell that wrong? Yeah. Potassium iodine, that's for our emergency preparedness. And I have a list of special needs in the community that we update every year. And we work with the EOC when we have our drills to say, identify people who live within the Millstone 10-mile radius. So that's some of the kind of things. And then, so this is so because we're, again, a Medicare certified agency, we are rated against every agency in the United States. There's about 12,000 of them, and they rate us 1 through 5 on quality and patient survey. And we usually rate between 4 and 5, which is super. And if you wanted to go on and get an agency, or your mother needed someone, or a nursing home, you can go on the Medicare Home Care Compare and find any hospital, any nursing home, any visiting nurse agency, and you can compare us where they are. And I can tell you that the other ones are not as high as us. So we are, in fact, we have been rated in the top 10 in the country a few years ago.
Wow.
And that's amazing. That is just shows how good we are.
Can you talk about those 2 certification badges on the cover page when you start out, Karen, and say more about your accreditations and awards?
Which ones?
On the cover page of the presentation.
Oh, the ones here?
Yeah.
So that is what those are associated with. The Home Care Elite Top 100 is the quality measures. So when someone comes into us, we measure them on how they move, how do they eat by themselves, do they get out of bed by themselves. So they give us this long, lengthy list to fill out, and when they leave, we fill it out again to see if they've improved or declined, and that's what they measure us against. Patient satisfaction, which is the FOSI, we're the top 25. They didn't run it last year because of COVID. They ask questions. Medicare will send you a survey after we close your case. They'll say, did your nurse come on time? Did they treat you with respect? Did they talk about your medications and your pain and your safety? Would you recommend them? So they ask them about 50 questions. They send it back to Medicare, and that compiles that list.
Excellent.
So it's all done. It's not done through us. It's done through the government, through Medicare.
Yep. Okay. I think it's important for residents to hear that, how good you guys are.
Yes.
Yeah, my goal has always been, since I've been in this job, to let the residents know how great we are and what a great service this town has. But the competition is so tough now because everybody wants the insurance money that they have to know to ask for us. They have to say, I want Ledyard VNA. And sometimes when you're in the hospital, they will say, we're going to have the VNA see you. And they're sick and they think it's us, and it's not us, it's theirs. And not until they're in it, and then they're not going to say, oh, I don't want you anymore. And they don't. So it's a little underhanded. what they do to, but that's business.
Karen, I have two questions. One is,
Sure.
what is EOC? What is EOC?
Emergency Operating Center, that's in the basement of the high school. It
Yep.
is, it used to be the bomb shelter. And that's where, if we had an emergency, everyone, the departments go, and they just had a drill 2 weeks ago with FEMA, and we have the real drill in June, and that's where emergency communications are.
Okay, you may want to avoid acronyms,
Okay,
some of those. And then the other thing is, and bear with me here, is there a age limitation to come in? Like you've got to peak over a certain age. For say, for example, you have somebody who's going to have their hip done, who's single, and they're like, what am I going to do here? Is there a service in it for them?
yes and no. We have a social worker if people need assistance, to give them, point them for resources and directions, but we are intermittent care,
Yep.
home health. So we will direct you, but we will not move in with you and, take care of you. We just kind of point you, and if you need assistance, we kind of help them try to find somebody.
Okay.
But we
Yep.
will try to. The other thing is that when Scott was mentioning renter's rebate, out of the people in Ledyard, what are we, 15? We have 15,000, 10,000. I had last year 33 applications for renter's rebate, which isn't a lot, I think.
This is like a small number.
Yeah.
So I don't know if Regina put it on the website, so it's there with the forms. It runs through April 1st till October 1st, and that is state-funded program. And so it is, and I think this year, for last year, I'll have more just because of COVID and people lost their jobs.
Wow.
So.
Go ahead.
No, that's it.
So the Counselor Ingalls and Counselor Solomon, do you have any additional questions?
I have a couple of questions. Karen, you mentioned a little bit of the update on, I seem to recall a few years back, you were frustrated with the situation with not being recommended. Like, the patients could be at a hospital and be directed to another VNA.
Correct.
So you mentioned Hartford Healthcare, but you mentioned that you're now in an agreement with Yale and L&M?
L&M and Yale are the same.
Okay. So is that new? Is that an improvement?
Yes, they will say that the VNA of Southeast is their #1 provider. That's where most of their
Okay.
patients will go to, and they tell you right out. But if the patients have want you, they will give you to us, because we are in the top. If our numbers were lower, they would not give their patients to us because of the quality outcomes. But they want us to, when they have someone come home from the hospital, we have to go in within 24 hours. That's the agreement with Yale, to see them, instead of 48 hours, which Medicare asks us. We have to do certain care plans and pathways and certain, so they're want very strict things and guidelines to get quality outcomes, which we said we can do.
Yeah. Okay, good. So then my other question is really the same one I asked Scott, and that's kind of like what is something that you wish the community knew about more so that they could take better advantage of it?
I don't know how to get the message out there that this is such a quality agency. This product that you would get, when people go shopping, they look for the best quality, the best service, and that and unfortunately, when they're sick in the hospital and they have issues and the hospital says, we'll give you somebody, they should be able to have us. They should say, well, you have a Ledyard VNA agency, but they used to do that about 10 years ago, but they stopped. So I just think that they would know that we are there.
Yeah.
So that is always my biggest pet peeves. And then you run into people and they said, we wanted you and we thought we were going to get you. So, and then they'll say we had them and they were awful. And so we're coming back to you. So I don't expect to get every resident ever, because we wouldn't have the people to take care of them, but I do expect, you know, people to have a voice and a choice.
Yep.
Yeah.
I mean, to have us. So I think that's it. I just want them to know we're there.
Mhm. Okay, thank you.
You're welcome.
And thanks for doing such a great job.
Well, you know, it's something I love and have always loved. And I think, you know, the people in Ledyard, Gales Ferry, I mean, a lot of them, you know, they need help. And they really, and especially at the end of life, the elderly, I mean, they really are sweet and cute and they need help. So, you know, I'm happy to be there.
Well, thank you, Karen.
So-
Mike, I have one more question
go.
for Karen.
Go ahead, go ahead, Bill.
Karen, when you mentioned LVs, I thought that term only applied to the volunteer emergency services ambulance service that we have.
Well, it does, but we still call it that.
Okay. It might confuse some residents.
Okay,
Because
I will, we'll look into another acronym, maybe. I'll talk to Ledyard Emergency Services, maybe,
Yep,
just for, you know.
exactly.
Yep.
Yeah, Ledyard Emergency Services, that
All right.
would cover police, fire,
Yeah.
and ambulance.
All right, let's
So-
do that. All right,
Good. Okay, thank you.
Thank you very much, Karen.
Well, thank you, and so this is what you want in 2 weeks, right?
Correct.
Okay, so
Yes.
Roxanne, I'll look for the date. I forgot when it was, but you'll let me know.
June
too.
2nd, but I'll send, right,
June 2nd?
right.
Okay, send me the invite. Okay, have a good night.
Thank you, Karen.
Bye.
Objectives and goals, I think we're on track for that. So I'm going to move on to any other old business to come before the committee. I don't think there is. For new business, I had under there a discussion to engage a facility to take part in conversation regarding cultural competency and social justice. That's not, this is to have a discussion, and the discussion is really about, it's a function, if you can recall the discussions that came in last week, the comments from town members of experience they've had in town. This topic is not within this is not part of the Community Relations Committee's mission statement. So wanted to have just a general discussion, and this is going to be quite a few iterations, I think, because my thought process was to see about getting a possible facilitator, not so much, I don't want it to be a discussion directly related. Now, this is my perspective. That's why I wanted to put it on the table for a little bit of discussion. I don't want it to be a discussion directly related to race, but more trying to talk about people's experiences. And is there a venue, okay, that could be put together to have. I'm trying to figure out how to address some of the, like the woman who lived over in the Highlands and got over in Fox Run, and the comment was, I would put it as a derogatory comment personally, that she encountered, or the woman who talked about the fact that somebody came up to her and talked to her about, asked her son if he could speak English, which kind of like throws me for a loop. Our mission is to address issues that are caused by the town proper as it relates to government. This steps outside that mission, and so this is really just a discussion with individuals who aren't trying to move the cause, because the issue becomes either lack of knowledge, inherent bias, or just, I don't want to say being a jerk, but I
Just did.
being a jerk.
So Mike,
Just
I think that we should not try to do this without a facilitator, and the discussion should be about when we want to do it. Do we want to get a facilitator? Because we're not qualified to have a discussion like that.
Bill,
Mike.
I agree completely, and I think the purpose here before trying to bring a facilitator in, because but I want to know what we're going to facilitate exactly. Trying to, or do we, because to bring a facilitator in and have the individual talk about what we want to do, we have to be aligned on some level on what would be the goal to have a facilitator come in. Is it going to be a facilitator who's going to come in and talk about, hey, you know what, there's prejudice and racism out there, and this, that, and the other in this group. I'm trying to go ahead.
So I really think that we should ask them to help us with that. Just tell them, here's the situation. Here's how people are feeling. Some people, here are the events we've been through. Here are some of the comments. Here are the newspaper articles. But clearly we need to have some kind of a discussion and just ask them how to approach it. And as you know, I spoke to one a year ago. Well, no, it was just before we started this committee. And she gave me some really good ideas. But I don't think we should go to them and say, this is what we want. I think we should ask them for help. And our job should be to vet the facilitators, see if we can find someone, and then schedule something for the fall. This isn't something we should just jump into.
No, I'm right with you. I just wanted to make sure the discussion took place now to figure out. That's why there's two possible facilitators just on the short on a short list that was thrown together quickly, and seeing about going out to see multiple facilitators, have them each come in and give a kind of a here's our issue, here's a concern. Is there something that can be done to talk about this that's going to be a positive for everybody involved? Yeah, no, I get it. I think it's going to take a couple facilitators, at least discussions, to figure out exactly what the discussion may be. I'm just trying to make sure that kind of can stay on a track that addresses those issues, and it's really not addressing those issues, just giving a venue or ability to have a discussion and to see if anything can be done on a town basis. But keeping in mind, what people think and what people feel, it's hard to wrap the fingers around that, and it's hard to change that mindset.
Which is why that's why I think we should get some professional help and just talk with them. I don't think we have to bring them into a meeting. Any of us can have a conversation. I've already had one. I think you have a conversation with a person and say, what do you think we ought to do? And if any of us think that person comes forward with an approach that we could make work, then bring it to the meeting.
Okay, that's a great idea. I'll reach out and have some discussions, and anybody who wants to reach out to somebody to tell them what the topic is, but you got to frame that topic is, I'm looking at the individuals who would come at the last meeting, and I'm looking at their concerns and their issues, and seeing, and is that what we're going to present to the facilitator? Or, because are we going to talk about, hey, we have how people treat each other? Can we improve on that? Is there something that can be discussed at a public forum? Because it won't be an informational, it'll be a public forum that would be useful to try and move that needle. So
well,
that's what,
as you know, I early on in this committee, I tried to work out a meal outside, given COVID, with some folks and just sit down and talk with them. And that can come under the guise or the umbrella of a workshop. you know, and that, so that was suggested by the facilitator that I spoke to. She said, just go have a meal together and have a conversation and see where that leads you. So, you know, there are all kinds of opportunities, but my point is the candidate or the facilitator should tell us or throw some ideas at us. And maybe we should take one of those. Another thing we could do is go to KERMA, because they provided a facilitator or a trainer to talk about sexual harassment for the town.
Yes.
So we could reach out to KERMA and see what they're doing.
What I will do is I'm going to give, I'll give a call to KERMA, and I'm going to give a call to another facilitator and just ask kind of some simple questions based on, see, that's how best to, what can be done as a, see, I'm having difficulty here, so bear with me.
Just call them. I mean, that's all I did. I wasn't prepared. I just called my friend and I said, here's what's going on. What should we do? And she gave me some great ideas.
I will do that and come back to the committee. And I'll set that, well, I won't put a date on that yet, only because we have something planned for our next meeting. So probably I'm gonna get information together, and then it's, when it's appropriate, I'll bring it toward the committee.
Okay.
Fair enough?
Yeah. Thank you.
Okay. Thank you, everybody, for your patience on this.
We'll get there.
With that being said, is there any other new business proper to come before the committee?
I have none.
Seeing that there's no new business to come before the committee, I move that we close I call this meeting adjourned without exception.
Thank you.
Thank you, everybody, for coming.
Okay. Night, everybody.
Good night,
night.
everyone.
Bye-bye.
Bye-bye.